The most amazing thing about Nina Medical is that we treat the prostate externally without penetrating the patient's body. Well, everybody knows that the BPH market is large but crowded. You can find more data in this the Lens magazine issue that I collected downstairs in the Pacific Ballroom. It gives some numbers. So, interestingly, you will find that all current solutions are invasive. They all go through the urethra, and we are going to break that paradigm. I am Ben-Ezra, a co-founder and CEO. In the next few slides, I will show you how. Prostate enlargement, benign prostatic hyperplasia, BPH, is a common age-related condition in men. It happens when the prostate grows and gradually blocks urine flow through the urethra. Symptoms include weak stream, incomplete voiding, frequent and urgent need to urinate during day and night, and disrupted sleep. Severe cases can lead to urinary retention, infections, bladder damage, and kidney failure. Studies show that most men over 50, which means hundreds of millions worldwide, struggle with the situation. The problem is that all current treatments are invasive, even those labeled minimal invasive, since they all go through the urethra. The mere thought of such a procedure is scary, leading many to avoid the experience. Their quality of life degrades, and they get to risk for complications. The quest for the prostate. Transurethral approach is common in BPH treatment on the left side. Transurethral approach is used in focal therapy of prostate cancer. And Nina Medical is pioneering a transperineal, non-invasive approach to the prostate and pelvic floor without penetration, just from the outside. We use high-intensity focused ultrasound, HIFU or HIFU, for selective thermal ablation of prostate tissue. The effect of HIFU on prostate tissue and the shrinkage of prostate after HIFU ablation is well known from existing products for prostate cancer. They use transrectal probe. They come from the rectum to the prostate. We just come from below. A treatment will target several points around the urethra. We are not going to destroy the entire volume of the urethra, and we will release the pressure, effectively release the pressure of the excess mass on the urethra. And this is the secret sauce. This is the difference between Nina Medical and other HIFU companies. We can observe the HIFU beam before starting the ablation. This is our proprietary ultrasound sequence. It provides us real-time imaging of the HIFU beam and focal point inside the body at low power. This visual feedback enables us to take more distant targets. We are confident in taking more distant targets, for example, shooting the prostate from the perineum instead of from the rectum. And this is the vision of Nina Medical for the future of urology, a brand new experience in the urologist's office. The device will contain a diagnostic therapeutic chair and an operator terminal. The doctor controls the procedure from the desk while the patient remains awake and comfortably seated. In the same position, the system runs examinations using robotic transperineal ultrasound imaging and treatment by HIFU ablation. Both imaging and treatment are performed from the perineum without penetrating the patient's body. With 30 million Americans suffering from BPH symptoms, the BPH market presents a multi-billion market opportunity. The current standard of care spans from watchful waiting through medications, while surgery remains the last choice down the road. Note that all current treatments, including the minimal invasive, cover only 2% of the potential market. By introducing a non-invasive treatment, we will address this large segment of men who suffer from the symptoms but don't treat. In addition, we will offer an alternative to medications as a first-line treatment. This is some about the competition. Surgical procedures like TURP, TURP, PVP, HOLEP, these are laser treatments, aquablation, the new one. All these are surgeries. They require operating room, general anesthesia, and hospitalization. Minimally invasive solutions like Optilum, Urolift, Resume, and iTind are good for outpatient settings. They reduce the cost for the system, and they minimize side effects for the patient. The time is right now for the next-gen non-invasive ultrasound-guided office treatment of Nina Medical. Our customers are practicing urologists and healthcare centers across the USA. We will not sell capital equipment. Rather, we charge per treatment. Customers will enroll to the Nina non-invasive program. We will provide them with the equipment, with the training, with the installation and continuous support, and we will charge per system usage. This is our board of directors, composed of exceptional team of industry experts. Christos is our chairman. He brings his leadership in medical technology and specific experience in BPH market. Howard from Raphael Holdings and IDT is our lead investor. Ayelet managed the laser surgery division at Luminis. Her division was acquired by Boston Scientific. Moshe founded Mazor Robotics, acquired by Medtronic. With their combined expertise and dedication, this team is poised to guide us successfully to market. We have accomplished technological readiness, including studies in preclinical and clinical settings. The proof of concept was on large animal models. You can find publications there. In a clinical trial, we have demonstrated on 20 patients the validity of the perineal approach for prostate examination. And now we are now gearing up for the first in-human clinical trial where we will treat BPH patients from the perineum for the first time in history non-invasively. We have recently closed the seed round, which will take us to first in-human during this year. The next round is planned for the end of this year after we have clinical data. We will go for a pilot study in 2026 and start the pivotal study in 2027. FDA clearance is expected in 2028. Several M&As in the field took place immediately upon FDA clearance. The last was Labori Urotronic deal for $600 million in 2023. Nina Medical defines a new category in the BPH market, the non-invasive treatment, bringing hope to millions who suffer in silence. Thank you for your attention.